So despite the fact that studying nursing in Finland is in the English language most of the time, that does not mean that the course is actually easy peasy. So here are 5 things that I wish every nurse should know before they decide to enroll to study nursing in Finland. The first thing I would like to emphasize on is that studying is actually different from practice, and this is something that you need to bear in your mind prior to actually becoming registered nurse or actually start practicing, because most of the time students tend to imagine that, oh, because the nursing study is actually very easy going, that's how practice is gonna be. But unfortunately, in practice things are a lot more different, and so you need to prepare yourself mentally and probably physically, because it's actually a different scenario or different ball game altogether. When you actually become a nurse, there is a greater part of the work because you have to become very responsible and a lot more things. So studying is very different from practice, so you want to bear in mind this and actually start preparing yourself to actually take up roles of responsibility when you actually become a nurse. Second point is something that we already all know, that the fact that you are studying in English language does not necessarily mean that you will not need the Finnish or the Swedish language in practice. So this is something that you want to bear in mind, that despite the fact that you are studying in the English language and doing all your exams and tests, when it comes to actually getting a job, you are required to get or to know the language, either Finnish or Swedish, to at least a B1 level or a good level that you can be able to communicate. So as a student, it is good that you start preparing yourself, you start working on your language, so that by the time you are graduating, you'll be already qualified, or you'll be able to maximize the time while studying to equally learn the language, because you don't want a situation where you've graduated and then you cannot get a job simply because you cannot speak either Finnish or Swedish. So keep this in mind and make sure to maximize very well your time as a student, because it's really gonna pay off. So if you have to, whatever routine that you want to do, please do it, but make sure that you get to learn the language as well as studying your nursing school. Whew, the sun is hot, and as we all know, Finland is a country that doesn't have a lot of sunny days, so I'm making the most to use all of the sun that I can use and that's the reason why I'm making this video outside today. And the nature is quite cool. You can see the leaves are moving. I really do enjoy nature, so yeah, let's do this. This other point is something that I recently discovered, and I feel like it's something that we need to really keep in mind. Like, keeping fit actually is not just for the girlies that want to look beautiful, but keeping fit as a nurse is an essential part, because the work is very physically demanding, and so you need to be able to find a routine for yourself that will help you to be fit. Because if you are carrying like a lot of things, like a little bit of heavy lifting, you need to keep fit so that you don't wear out yourself. Because over time I've seen that a lot of nurses get to have certain kind of injuries because of lack of you're having enough muscle strength. So you want to keep this in mind and already start building that routine while you are still a student. Next off, that is very, very important, is that you need to be able to develop critical thinking skills, or team, being able to work in teams. I know that one important thing that the Finnish universities do or practice is that they make students to get used to this, working in teams, presenting and stuff like that. This is something that I feel is a skill that really plays a lot of good role when you're actually a nurse, because you have to be able to communicate. For example, you're working in a multidisciplinary setting, you have to be able to communicate with doctors, with your colleagues, nurses, with other healthcare departments and stuff like that. And having that ability to really communicate ideas is very, very important. It's not just about the language, but also being able to communicate in a way that people can understand you. Yeah, so basically those are the things that is really going to help you if you are able to communicate and you be able to work in team. Because definitely there are some times that if you have to choose who you want to work with, it will really become a very tedious something for you. So being able to work with people, even though you are not in the perfect term with them, will really go a long way for you. Because as a nurse, you don't get to choose who you work with, even though sometimes that happens, but you need to be able to accommodate people, work in teams, and make sure that your communication most of the time should be very, very professional. So you don't bring bias to the workplace. Even if you are having a beef with someone, you should be able to still do your work even if you are put in team with that person. So that's the essence of you being able to build that skill of working in teams and also critical thinking. Now, about the critical thinking part is that not everything that you are being taught in school you will definitely, find at work, because you definitely find more, and there are certain things that you just need your common sense to be able to evaluate these situations and make the right choice. That's very, very essential. So yeah, work on your critical thinking skills and also your team building skills, okay? Last but not the least, very important thing that I feel every nurse or every nursing student should really put at the back of their mind is that nursing is a profession, or healthcare in general is a profession that you constantly have to be improving yourself. So for those of you who think that, oh, once I graduate, once I get my degree, that's all about it, I'm just gonna pack the books and keep it somewhere, please, that should just delete that idea, okay? Because nursing is constantly improving, and there's always a need for you to improve. So don't just have that mindset that, okay, now that I've gotten the job, that's it. Always seek to improve yourself, and I tell you the truth, you will thank me later. So basically, that's it about the ideas or the things that I wish every nursing student should know, or every new grad should know before diving fully into the field. I hope that you learned one or two things from this video, and please make sure to comment in the comment section below, ask more questions, or probably suggest more topics that you want me to make videos about, and I'll see you in my next one. Bye.